In a small town in North Carolina, Chelsea Ann McKinney, a dedicated housewife, was looking forward to spending their school holidays with her two children, 8-year-old Keona and 14-year-old honor roll student Matthew. As the summer of 2021 kicked off, the kids were excited about their break from school. However, little did they know that danger lurked beneath the surface of a nearby lake. On June 15, 2021, Chelsea Ann decided to take her children, along with the neighbor's kids and Matthew's friends, James and Michael, to the lake. They spent the day enjoying the sun, diving, and playing in the water. That night, an exhausted Matthew went to bed early, completely unaware of the looming danger he was about to face. At 2 a.m. on the same night, Matthew awoke feeling feverish, experiencing pain in his nose. Chelsea Ann, worried by his temperature, which was at a whopping 103.6 degrees Fahrenheit, immediately got Keona ready and drove her and Matthew to the local hospital. As soon as they checked Matthew in, the doctors, suspecting sinusitis, prescribed antibiotics and sent the family home. Over the next 3 days, Chelsea Ann took care of Matthew to the best of her ability, growing increasingly concerned as she noticed swelling that was around his left eye and nose progressively worsen. A couple of days later, on June 19th, Matthew alerts his mother to a frightening development. His teeth seem to be moving, with one tooth noticeably out of alignment. Chelsea Ann rushed Matthew back to the hospital, where doctors, still suspecting severe sinusitis, attempted to drain his sinuses. Finding that they were dry, they would then admit Matthew for further testing. The test revealed alarming gum swelling and pus surrounding his loose teeth. Desperate to uncover the cause of Matthew's condition, doctors then took a biopsy of his gum tissue. As they awaited the test results, Chelsea Ann would notice small black spots begin forming around his left nostril, a sign of dying flesh. Fearing for her son's life, the desperate mother then agrees to have Matthew transferred by helicopter to a specialist unit 80 kilometers away. Dr. William Shockley and his medical team would then assess Matthew's condition upon arrival. They noted a high fever, rapid pulse, and disorientation, suspecting septic shock caused by an unidentified bacterial infection. A couple of days later, on June 21st, the surgical team removed dead tissue from Matthew's nose, as well as his gums and his palate. Infectious disease expert Dr. Tom Bellhorn would then join the case, determined to find the origin of the rapidly spreading infection. It was around this time that the test results would finally arrive, revealing the cause of Matthew's sufferings: Chromobacterium violaceum, a rare flesh-eating bacteria found in tropical and subtropical environments. Chromobacterium violaceum produces a potent toxin called violacine. This toxin damages the body's tissues, leading to the destruction of skin, muscle, and even bone. When the bacteria invade the body, they release this toxin, which then triggers an inflammatory response and ultimately leads to tissue damage. Additionally, Chromobacterium violaceum is resistant to many antibiotics, making treatment challenging, which is why doctors often need to use a combination of antibiotics to combat the infection, and the choice of these depends on the patient's specific case. Despite this resistance, with timely and targeted treatment, the antibiotics can eventually help eliminate the bacteria and prevent further tissue damage. To add on to a rapidly growing list of concerns, Dr. Bellhorn would then discover through further testing that Matthew suffered from a weakened immune system due to chronic granulomatous disease, making him susceptible to the bacteria. Chronic granulomatous disease, otherwise known as CGD, is a rare genetic disorder that affects the immune system's ability to fight off certain types of bacteria and fungi. CGD causes the immune system's white blood cells to produce abnormal amounts of reactive oxygen species, or ROS, which are normally used to kill harmful bacteria and fungi. However, in people with CGD, the ROS levels are not sufficient enough to kill the bacteria, which allows the pathogens to grow and in turn cause infections. As a result, it's fair to conclude that people with CGD are much more susceptible to bacterial and fungal infections in general, and the infections can thus be much more severe and difficult to treat. The doctors at this point, who were even more curious about the case, would begin to question Chelsea Ann about her and her family's whereabouts in the recent weeks. It was at this time that Chelsea Ann would recall their fateful trip to the lake on June 15th. She would then provide crucial information about how Matthew had come into contact with a deadly bacteria, prompting Dr. Bellhorn to promptly administer targeted intravenous antibiotics to Matthew. Antibiotics are drugs that are specifically designed to kill bacteria or prevent their growth. In Matthew's case, the specific antibiotics he was given were specifically meant to target the Chromobacterium violaceum bacteria that had infected him. The antibiotics work by either stopping the bacteria from growing, destroying the bacterial cell wall, or interfering with its protein synthesis. Once the bacteria are unable to grow or are destroyed, the body's immune system can then fight off any remaining bacteria and begin the process of healing. After 4 tense days of treatment with these antibiotics, the deadly bacteria would finally begin to recede, at which point Matthew was finally declared no longer in critical condition. And about a week later, the resilient 15-year-old was released from hospital and returned home to his family. Although the antibiotics successfully eradicated the bacteria, Matthew's face bore permanent scars. He underwent 5 reconstructive surgeries, including procedures to rebuild his nose. Matthew's case is one of the few reported cases of C. violaceum infection in the United States, and would go on to garner national attention due to the severity of his illness, as well as his remarkable recovery. His harrowing experience serves as a warning for all, especially those with weakened immune systems, to ensure that in order to minimize the risk of infection, it's recommended to avoid unchlorinated fresh water and damp soil when swimming in tropical or subtropical climates. After Matthew's survival, the McKinney family became dedicated advocates for spreading awareness of waterborne infections and the dangers associated with compromised immune systems. Through their participation in various campaigns and events, they educate the public till this day on proper water safety and hygiene practices. And Matthew's mother, Chelsea Ann, now a passionate water safety advocate, proudly shares her son's story on social media, blogs, and local events to reach families who may be unaware of the risks and provide them with the knowledge to protect their loved ones. And despite his physical and mental scars, Matthew remains active in his community and inspires many through his resilience and determination. If this episode piqued your interest, then our previous episode about an abalone diver who was caught waist deep in the jaws of a great white shark is likely to do the same. You can find it on the end screen of this video.